You're welcome once again to the African Nutrition Society podcast. We are at the Africa Nutrition Conference 2024. It's been insightful. There's been some highlights on school health and nutrition. We've been discussing food security and food systems, and I have with me one of our high-profile nutrition experts. I always say that and they tell me, no, don't say that. But I have with me Professor Robert Akparibo. He's one of my mentors, and he's an associate professor in public health and nutrition based at the School of Medicine and Population Health, the University of Sheffield, UK. He's also a visiting professor at the Fred Binker School of Public Health, the University of Health and Allied Sciences, Ghana, and the University of Development Studies School of Allied Health. He currently chairs the Nutrition Community of Practice of the Global Research Consortium of School Health and Nutrition, and is a member and co-chair of the Global Special Interest Group for School Health and Nutrition. Professor Akparibo has consulted for organizations such as the World Food Programme, the World Health Organization, Oxfam GB, the UK Foreign and Commonwealth Office, World Vision International, the European Communicable Disease Control, and the UK National Health Service, including the UK Local Government Council in the areas of public health and nutrition. He has been playing a lead role in developing and supporting the capacity building of early career researchers in sub-Saharan Africa. You see why I say high profile? This one I even shortened it. Prof, you're welcome.
Thank you very much.
So you've been around. I'm excited to have you on. It's really humbling to be communicating with you and all the other nutrition experts from all over the world. And we've been very busy over here. I struggle to pull you here. So with all the experiences that you have had, you've come to impact that knowledge, that information for us to have practical approaches. What has been your impression throughout the conference, pre-conference School Health and Nutrition, the food security, food system discussions?
Yeah, thank you very much. I'm always happy to be home. Ghana is my home, so anytime I get opportunity to be here, I'm happy. So this time around is the African Nutrition Society Conference, and I'm part of it. I'm a member of the African Nutrition Society. I am the regional rep for Europe and UK. So, whatever that we are deciding for the Nutrition Society, I play a role in that. So this conference has been the 9th one, right? It's the 9th conference, and we can only get better. Right. I remember the first time I attended was 2010. That was in Kenya. And since then, we have really evolved. We have come a long way. My impression is that when I attended the first one, it was all about researchers, bring researchers together to share what they have been doing in terms of research in their countries. But now I can see that development partners are interested in African Nutrition Society Conference. Practitioners are interested in the African Nutrition Society Conference. And I even see quite a number of policymakers who are part of, the agenda. And this is really interesting because we have struggled over the years to bring these stakeholders together. If you do research, and you expect the research findings to be utilized or to be applied to address the issues that we are trying to address, and you don't involve the people who matter, the people who make the decisions, the people who make the implementations, then at the end of the day, you only publish them and nobody reads them. So that is not impactful. I mean, in academia, some of us define impact as having the number of citations, the number of papers you publish. But this time around, I mean, impact is not measured by the number of publications you do. It's not measured about how many citations you have. It's measured about how has your work contributed to influence policy, to change behaviors of people, to inform interventions. So that's what has. So I'm really happy that the conference has evolved to this stage where we have these players coming in, and this week has been amazing.
I see that. So please share with us. This is getting a bit personal with you. I would like you to share with us your journey in public health and nutrition and what inspired your focus on school-age children and adolescents.
Yeah, thank you very much again. Growing up, I mean, that's everybody's dream in Ghana always has been, I want to be a doctor, isn't it?
Right.
So I went to secondary school, Tamale Secondary School to be precise, and I studied general science. And, you know, the ambition has always been, okay, I want to study science and I do medicine. So that's what has always been the ambition. And after secondary school, we were the third batch of the SSS, so I'm not really young.
Third batch of SSS?
Yes.
Wow.
So yes, so we're the third batch of the SSS, and it was tough at the time because you have fewer people, you know, going into the university, not alone even doing medicine. So a number of us did not have the opportunity. And even if you had a grade, you know, it had to do with who you can see to push you through. I'm not saying those who went to the medical school were pushed through, but if you haven't got the connections to support with your grades that you have, it was difficult to do that. And then, yeah, so I initially went to do engineering.
Okay.
Yeah, I went to do engineering, and engineering drawing drove me away because I couldn't just draw the side view of the building. So I had to leave, and that was the Tamale Polytechnic. And then, gratefully I got admission into UDS to study nutrition, and at that time I still had the hope that I would do medicine. That was and eventually, when I finished the degree, I had the opportunity to go back and do that. But you know, that wasn't really being exposed to nutrition changed my worldview about how medical practice is. And even when I was doing my undergrad, we had the opportunity to be in the consulting room because of doing anatomy, observing how doctors treat patients. So they will call patients one after the other to come in and they will see them. And we had the opportunity to go to the community to see what is happening. Because you see that somebody would come with malaria, right? And the person will be treated with chloroquine, then goes back home, and 2 weeks' time, it's the same patients. They treat the person with chloroquine, then goes back. You know, so it means there is something in the community that needs to be addressed, and that's where public health comes in. So there's water and sanitation issues, there's diet, you know, that is making their immune system weak. That is why, you know, mosquito bite them small and then they have malaria. So, so being exposed to those really changed my perception about doing medicine. So I just thought that, well, I think public health is where I belong to. So when I finished undergrad at this national service for 1 year, and my passion has always been to go to public health. So I was fortunate to be the first batch of the West African Health Organization interns. So
only big places, Prof.
So I was there with Mawuli Sabla, and we were the 2 Ghanaians who were selected from Ghana to join that program alongside other 4 Africans. And we went through public health training in Bobo Dioulasso, Burkina Faso. We learned to speak French at the time.
I heard you teasing each other the other day.
The other day, yes. So, so when I came back, I went into public health proper. I worked briefly with a non-governmental organization where I was in charge of developing programs to address health and social needs of Ghanaian population in the northern side of Ghana. And then I moved to UNICEF. So I worked with UNICEF, where I was working with the regional health director of Upper East region to kind of scale up innovative interventions to address maternal and child health issues. And I led the development of the we used to call it the INAM project that now evolved to become the CMAM. Now we call them CMAM. We used,
Okay.
so it was initially piloted as an INAM project. So I was one of the brain behind that.
Okay.
And UNICEF led that, and we really achieved success.
Interesting.
And so I started to see my work being recognized. When I go to the communities, I see the way children are improving and women are happy and all that. So it inspired me to stay in public health. Then I served, UNICEF for a while, and then migrated to the UK through scholarship that I had from the European Commission. And it was for me to study in multiple countries. So I wouldn't refuse that, would you? So
you've had so much experience, diverse experience.
So I went there, and then I studied Masters of Public Health, and finished, went to University of Copenhagen. So that was University of Sheffield in the UK. So when I finished, I went to University of Copenhagen in Denmark to study for advanced statistics and epidemiology. Just advance my public health knowledge a little bit. Then I came back, did a PhD in the same area, and yes, I've been working, teaching and researching, and my research focuses on food insecurity, management of children with malnutrition, looking at the global, the double burden of malnutrition more generally. But what inspired me to, did you ask that question or?
Yes, I asked what your journey in public health had been and what inspired your focus on school-age children and adolescents.
Yes, so I have a long story to tell, but I'll make it short. So my days in UNICEF, UNICEF is focused on children, focused on improving the health and well-being of children, and I was working in that team. So that kind of developed my interest to be working around children and the area of children and women. And so in 2020, whilst we were in COVID, we're in lockdown. WFP approached me through a South African company. They got a consultancy for them to look at the evidence around the implementation of school health and nutrition programs. I don't know where they got me from. They invited me to be part of the team. Okay. And I led the West African part of the team. We gathered the evidence, and it was shocking. It was shocking how school meals can really change the lives of children. But I don't know why our African governments are not really prioritizing that. So I thought that was an approach that we can really use as an entry point to help address the health and nutritional needs of children. So from there onwards, I have tried to see what I can do for these young kids, how I can advocate for scaling up school meals programs, for scaling up school nutrition programs. Globally. And then the Nutrition Society of the UK wanted a group to be formed to kind of lead the process of advocacy for school meals. So I thought that, yes, this is what I've been thinking about. So I led the team together with Professor Alan Jackson, and we set up the Global School Meals Special Interest, a Global School Health and Nutrition Special Interest Group, which I co-chair with Professor Alan Jackson. And we are an advocacy group. Okay. And this is what we do. We engage with government, we engage with practitioners to see the need to invest in school meals. And so in 2022, the research consortium the Global Research Consortium for School Meals was formed, and it is an initiative of the Global School Meals Coalition. I don't know if you know about that. Yeah. And this coalition is made up of 103 countries, and Ghana is one of those countries. So they came together to pledge that school meals is the way forward. And so they need to see school meals as a strategy to build future human capital. And so when that happened, we needed research to be able to inform the scale-up. And the research consortium was formed. So when the research consortium was formed, there are two thematic areas within the consortium, and nutrition is one of them.
Okay.
So I got contacted by the director of the consortium, which is Professor Donald Bandy, that yes, I mean, I see you work in this area and I want us to work together to make this happen. So come and lead the Research Consortium Nutrition Community of Practice. And that's where I got interested. So I've been a global advocate, not just Ghana. Last year I was at the Global School Meals Coalition where, you know, took part in a panel discussion with health ministers to talk about some of the challenges that we can address to ensure that school meals are scaled up nationally for children and families.
Right. You've spoken about food security. You've talked about malnutrition. How do you see the intersection, or how do you view the intersection between these two concepts within the school health programs?
So, the school meals program addresses a number of issues. First is to help children to go to school. So that's the first objective. So almost all governments, when you ask government why are you doing school meals, it is to scale up. I mean, it is to universal coverage of increasing the numbers of children who go to school, especially the girl child. I mean, and then the second point is that we need to address the food issues. There are many children in their communities who don't get to eat, and that leads to hunger. Hunger would exacerbate malnutrition, and so school meals is a vehicle to address hunger, address malnutrition. And so if there is food insecurity in a country, well, you know what will happen. So there would be increasing levels of children who are suffering from hunger, increasing level of children who are then suffering from malnutrition. And so if you want to address these indicators, then school food insecurity is what we should address. I did a paper with a number of colleagues, including Professor Richmond Aite, and we realized that there's a lot of work done around food insecurity in Ghana, for example. But food insecurity has so many dimensions, and one of them is safety, you know, food safety, food hygiene. So you may have the food, but if the hygiene is not there, then there's no food.
How we store our foods, we bring them from the markets, we don't clean them,
Exactly.
We keep them anyhow.
Yes, so you may have the food. Food may be in abundance, but if the safety of the food, if you are not happy, if you think that this food I'm eating is not safe, then there's no food.
Right.
And so that is the issue when you link it to school meals. So how safe is the food that our children are eating? You know, so that's the link, some of the links of food insecurity when you talk about school meals. The quality of the meals is also another, and all that. So,
Prof, you talked about how you came together to develop some of these programs and all that. All of these involve policies, right? So in your experience, how effective have the current policies been in addressing the nutritional needs in schools? Because many times we have meetings, we go to conferences, we say nice things, we present success stories, but then you go to the ground and we don't really see the evidences that we report in our meetings.
Yeah. Globally, there's a neglect for school-age children and adolescents. So there's a neglect in terms of recognizing them in policies. There is a neglect when we are collecting data to estimate the burden of malnutrition in children. There's a neglect in terms of interventions. That is because we don't have the data, you know. So if you look at all the policy documents and you review most countries' policy documents, they don't mention school-age children and adolescents. Just a few countries have that. They don't have, you know, we don't collect data. Even the Ghana Demographic and Health Survey, if you take the data, you don't see school children captured in that. So this age group is a neglected group. And so But because we have been drumming home the message, countries are beginning to see the need for policies to support this group. So most countries begin to now have school meals, delivery policies, and legal frameworks. And one of the work that I did for a World Food Program was to look at how many countries in Africa have school meals policies and legal framework.
Okay.
And West Africa have got only 9 countries that have got school meals policies and legal frameworks to guide the implementation of school meals. Now, if you don't have a policy to guide an intervention, it doesn't work, because you need a policy to be able to guide, to be able to inform the delivery of the intervention, and to be able to even track change. But we don't have these policies. How do we make a change? So that work has informed the direction of travel for World Food Program. So World Food Program is really an advocate for school meals. So it's going to inform their next 5 years agenda, that they'll be working with government. So I know that as of today, because that was 3 years ago, now we now have almost 80% of countries having developed school meal policies and legal frameworks to support the scale-up of school meals. So that's the issue. So yes, we go to conferences, we talk about all these things, but when you go to the ground, the reality is not there, because we don't have the instrument, the policy frameworks to be able to support the implementation of what we talk about.
So, Prof, what should we do the way forward? In your final words, what should we do as a people, as a country, to those who implement these programs or policies on the ground? What should we take away?
So we have been doing case studies in countries. So when I say we, the research consortium, which I'm a part, have been doing research around documenting the value for money for delivering school meals program. In Africa, we've managed to do 2 countries. I think there are about 10 countries that are participating in that.
Okay.
And clearly, yesterday we made a presentation.
Okay.
Clearly, there is a value in investing in school meals. Maybe our governments are not aware of this. So we need to move beyond talking.
Okay.
And forming advocacy groups that we can engage with these stakeholders, like government stakeholders, and let them see the need to invest in school meals, to invest in school nutrition. There's a need for capacity building. We've been discussing, before the conference started, pre-conference, Saturday and Sunday, that we need nutritionists to be involved in the delivery of school nutrition programs.
Exactly.
Currently, we don't have that. What we do, what we see is health workers going to, schools to do health education, and some of these health workers lack the knowledge on nutrition. So we need to be able to integrate nutritionists into the delivery of school nutrition programs. But before we do that, their capacity need to be developed. Their capacity need to be built. They can work with the health workers alongside. They can work with the teachers alongside to make sure that we catch the young children young, educate them on the need for healthy eating, and that probably would bring a change. We used to have school gardens in schools. We know that school gardens cannot power, or it's not a solution to delivering large school meals programs, but they can be used as pilot programs to help children learn how to grow vegetables in school, come back to their homes and teach their parents that you need vegetables, you need this. So once we do, children are very powerful.
Right.
We underestimate their knowledge, but if you channel all these things through children, then we have a future.
All right. That being said, you have been watching the African Nutrition Society podcast. We've been discussing food security. We've had Prof. Akparibo discuss with us some of the things we need to do. we've been discussing from previous interviews how to start early, start right, keep doing what you're doing right so that we can have good productivity, we can have healthy children, healthy adults who grow up and make good decisions for us. Thank you for watching. We've been sponsored by CRS to enable us achieve this interview. See you next time.